Everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In today's episode, we're going to be discussing a medication known as Flecainide. Its brand name is Tambocor. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. In this presentation, we'll discuss the mechanism of action or how this medication works, indications or reasons we would prescribe Flecainide to a patient, followed by contraindications or reasons we would not be able to prescribe this medication. We'll then follow it up with examples of dosing and finish it off with side effects with percentages. I've put together some slides to go over this information, so let's just jump right into it. So the first thing to discuss here will be the mechanism of action or how this medication works. So flecainide acetate is a class 1C antiarrhythmic drug. It acts on the fast inward sodium ion channel and has a high affinity to activated or open sodium channels. It potently acts on the His-Purkinje system. In terms of indications or reasons we would prescribe this medication to a patient, medication can be used prophylactically or preventatively for the following situations: in paroxysmal atrial fibrillation, paroxysmal atrial flutter, paroxysmal supraventricular tachycardia, or for life-threatening ventricular arrhythmia. In terms of contraindications or reasons we would not be able to prescribe Flecainide, well, we wouldn't give this medication to a patient who had a hypersensitivity to Flecainide or to any other component of the formulation. If a patient had cardiogenic shock, they would not use this medication, as well as patients who have second or third degree atrioventricular block without a pacemaker. If a patient had right bundle branch block with left hemiblock and also without a pacemaker, that would also be a contraindication to using Flecainide. Now for some examples of dosing with Flecainide. So in the treatment of atrial fibrillation, like we mentioned prophylactically, initially a patient would use 50 milligrams orally every 12 hours. They would then have the option to increase their dose by 50 milligrams twice daily at least 4-day intervals. The maximum dose in this situation would be 300 milligrams daily. Again, that would be given in divided doses. For ventricular arrhythmia, the initial dose would be 100 milligrams orally every 12 hours. Then they get again increased by 50 milligrams twice daily at least 4-day intervals, with the maximum dose this time of 400 milligrams daily. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using Flecainide, so I'll go over some of those here now. 6% of patients may experience palpitations, while 10% may experience nausea. Dizziness seems to happen 19 to 30% of the time, and blurred vision may happen 10 to 38% of the time. Dyspnea or difficulty breathing comes in at 10%, and fatigue comes in at 7.5%. 5 to 10% of patients may experience a headache, and up to 30% may experience photopsia, which would be the perceived viewing of flashes of light in your field of vision. Some serious side effects would be heart failure or prolonged QT interval. Alright everybody, that's all we're going to talk about today with Flecainide or Tambocor. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. So for today, take care.